Greetings. I have asked this patient to empty his bladder and remove his clothing for this exam. I have gotten his vital signs and his height and weight, and I've also checked his distance vision with the Snellen chart and a near vision screening test with the Rosenbaum chart. And that tells me that his optic nerve, cranial nerve number 2, is intact. I've just washed my hands and I am ready to begin my head to toe physical exam. Hi, my name is Mary Beth.
Hi, Mary Beth.
If it's okay with you, we are going to videotape this exam, and I'll be talking to the camera throughout.
Okay with it.
Very good. So I'm going to start with a general inspection of his skin, and his skin appears to be pink. I'm not seeing any lesions at all. Everything looks intact. His hair distribution is symmetrical, well distributed throughout. I'm going to feel for his warmth with the back of my hand, and he is nice and warm. The skin is dry, and his trigger is good, meaning you're well hydrated. So next I'm going to just inspect his head and his normal cephalic, a good distribution of his hair, and symmetrical facial features. His ears are level with his eyes, so they're in a good position. And I just want to look at your scalp, and I'm seeing no lesions here. His skin is intact. I'm going to feel for movement of his scalp, and that moves nicely. And tell me if you feel any discomfort while I'm palpating. Anything?
No.
Okay. And around here. All okay. Can you open and close your mouth? Good. Any pain in your TMJ here? Very good. Now if you could clench your teeth. And he's got really good musculature bilaterally of his mastication muscles. Any pressure, any pain when I palpate over your sinuses, frontal and maxillary?
No.
Those are okay?
No.
Okay. I'm going to have you wrinkle up your forehead like you are, like you're worried. Very good. And open your eyes and shut them tight. Very good. Now you can smile and frown and puff out your cheeks. Very good. Now, if you close your eyes, I'd like to just test the sensation of your skin on your face. I want you to tell me if you feel a sharp sensation or a dull.
Sharp. Dull. 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 Sharp. Sharp.
Very good. And keeping your eyes shut, I'd like you to tell me where you're feeling this soft sensation.
Left forehead. Right forehead. Left cheek. Right cheek. Left chin. Right chin.
Very good. And that just tested his facial and trigeminal nerves, cranial nerves 5 and 7, or 7 and 5. We do it that way. And let's see. Next I want to inspect your eyes. So I'm going to start with his eyebrows, and those are symmetrical. His hair is all intact. I'm seeing no lesions. If you could close your eyes, I'm looking at his eyelids, and those are without any lesions or edema. And your eyelashes, you can open your eyes here. These eyelashes are not turned in or out, and without any lesions there or redness or edema. To palpate, any tenderness here?
No.
And again, I feel no lesions or no edema around his lacrimal glands. Any tenderness here?
No.
Okay, you can open your eyes. Just want to look at his sclera. They're nice and pink and moist. and I'm not seeing any lesions. And I'm sorry, in the conjunctiva, there's no lesions, and his sclera is nice and white. There's no jaundice. Looking at his pupils, they're nice and round. They look to be about 4 millimeters, and I'm going to check for reaction to light, and good brisk constriction there, and good brisk constriction there. So that's direct. I'm going to look for indirect in the opposite eye. That looks good, and that looks good. Now if you could focus on a distance far away, and then I want you to focus on this pen, and I see an accommodation constriction there. Next I'm going to check out his movement of his eyes. If you could follow this pen with just your eyes, and down, and up, up. Now it's going to come right at you. Keep looking at it. Very good. And I didn't see any extra movements. Next I'm going to do this cover-uncover test. So what I want you to do is focus on maybe that book there. And I'm going to cover one eye. So you're focusing with just the one eye. And as I uncover the other, I want you to focus with both eyes. And there's no extra movement there. And we're going to do the opposite. Focus with just that side. Now with both. And I see no extra movements. So that just tested cranial nerves 3, 4, and 6, and those are all intact. Next I'm going to go to your ears. Looking at your ears, again they are symmetrical. I'm not seeing any lesions there, no lumps or cuts or anything. Do you feel any tenderness here in the auricles? Okay, how about when I tug?
Mm-mm.
Okay. I'm going to test his hearing. So what I want you to do is tell me if you hear one side, hear the ringing on one side more than the other.
No, it sounds equal.
Okay, and that is the Weber test. Next I'm going to test for air and bone conduction with your hearing there. Now tell me when, can you hear that through the bone?
Mm-hmm.
Tell me when that disappears.
Okay.
And can you still hear it?
Yes.
Tell me when that goes.
Okay.
Okay, we're going to try the other side. Tell me when that goes away.
Okay.
And can you still hear it?
Yes.
Tell me when that disappears.
Okay.
So he seems to have good hearing on both sides. The air conduction is longer than the bone conduction, which is normal. So that tested for his cranial nerve number 8, the vestibular cochlear nerve. And so next I want to look into your ears. Okay. Put that up and away. Put that a little light. First I'm going to look into his ear canal, and that's nice and pink without any extra cerumen. I'm looking at the tympanic membrane now, and it is nice pearly gray. There's no bulging and no fluid behind the ear, or behind the membrane. On this side, I'm going to look at the canal again, and that looks nice and pink. And I see the tympanic membrane. It's nice pearly gray, no bulging, no fluid. Okay, next I'm going to examine his nose. To look at his nose, it is symmetrical. I see no lesions. The skin is all intact. I want to taste or check your smelling. So, well, first let me check for the patency. Can you occlude one note there? There you go, and breathe in and out. And the other side. And out. And do you have equal air exchange, do you think? Okay. Now closing your eyes and including the one side, tell me what you smell here.
Coffee.
Very good. And including the other mirror. Can you smell this?
Ginger.
Very good. So that tells me that his olfactory nerve, which cranial nerve number 1, is intact. And now I want to look into your nose. Okay. Now, just put your head back. There you go. Oops. And his mucosa is nice and pink. The turbinates are not enlarged, and his mucosa is not edematous. Here's this side. Again, it's nice and pink. The septum is intact on both sides. The turbinates are not enlarged, and the mucosa is not edematous. So next, I'm going to examine his mouth. Looking at his lips, they are symmetrical, and I see no lesions, and nice pink color. Can you open your mouth? Very good. I'm going to look at your teeth. Very good. There's no inflammation, and his teeth are a nice white yellow. Open up. I see a few fillings in there and some spacers. Are you about to get some braces?
Yes.
Let me take a look. Very good. Okay, now I just want to look to the side of your tongue. Move it. There you go. And the other side. That looks good. And underneath. Good. I'm looking for any sores or lesions in his mouth, and I see none. There's no swelling of the ducts here. Let me see the side of your mouth. No swelling there. And your duct there. Okay, now if you could stick your tongue out. Very good. Can you go side to side and up and down? Good. And if you could push against your cheek with your tongue, against my hand. Good. And the other side. Good. So that's checking for cranial nerve number 12, the hypoglossal, and he's got good tongue control. Now, checking the back of his throat. Can you say, stick your tongue out? Good. He's got a nice rise, midline rise of the uvula. The arches are symmetrical. Again, stick out. I'm going to see if I can touch the back of your throat and stick your tongue out. I'm going to see if I can get it. Okay. So that, and then swallow for me. And do you have any problems with swallowing fluids or foods? So that just checked the cranial nerves 9 and 10. Let's see. His cheeks, the buccals were nice and moist, and no excessive redness there. And next I want to check out his neck. First, I see good symmetry there. His trachea is midline. I'm not seeing an enlarged thyroid. I'm going to go ahead and feel that, and his thyroid feels nice and smooth. While I'm here, I'm going to palpate his carotids one at a time, and that's good. It's a good 2+. I am not seeing any JVD. Next, I'm going to palpate all of his lymph nodes to, and you let me know if you feel any tenderness. So, periocular feels good, postocular, good, tonsillar, nothing there, submandibular, that's good, submental, nothing there, anterior cervical, superficial, maybe a little lump there, that's okay. Posterior cervical, nothing there, nothing there. And then deep anterior cervical, nothing there, and nothing there. And next I'm going to do your supraclavicular. If you could kind of bring your shoulder there, not so much down, but just turn to, there you go. And I'm feeling in there. And this side, bring your shoulder forward, head down just a little, there you go. And nothing there. And then I'm going to feel the ventricular, nothing there, and axillary, nothing there. And on this side, feels good. And axillary, nothing there. Very good. Any tenderness in any of those spots?
No.
Okay, before we move away from your neck, I'm going to check your range of motion. If you could go chin to chest and back, ear to shoulder, both sides, and chin to shoulder, chin to shoulder. Very good. Now against resistance, I want you to try and turn chin to shoulder. Good. Chin to shoulder. Okay. And if you could try and shrug your shoulders against resistance. Very good. So there I just checked cranial nerve 11. That's spinal accessories, and that was good. And I believe we completed your neck. Next, I want to go to your upper extremities. So again, skin is intact, well distribution of the hair. I'm going to feel for the pulse, brachial pulse. Nice and strong, radio. That's good. I'm going to check his circulation to his fingers, looking for the capillary refill. And that is very brisk, less than 3 seconds. Okay, and other side. Pulse. Good. Pulse there. Good, 2+. And your capillary refill. Good. Fingers on both sides are well groomed. The skin is all intact, no lesions. I'm seeing no clubbing of his fingernails and no ridges, and there's no extra thickness to his nails. So that all looks good. Testing your range of motion, your arms, wrist, and here, arms, and your wrist. And all your fingers work good. Very good. And for your strength, you could try and pull in and push out. Good. Pull in and push out. Good. Now if you bring your arms out to your side, can you lift up and down? Good. And bring your arms all the way up and all the way down. Any discomfort with any of those movements? Very good. Okay. So next I'm going to, I need to listen to the Fabruis on your neck. So just, if you could just hold your breath for a second and breathe out. Now hold. And I'm hearing no bruise over his carotids. So next I want to examine his chest, and I'm going to start, with the back part of your lungs. So if you could turn to the side, maybe turn that way. So first I want to inspect his back, And again, his skin is intact. I am not seeing any lesions at all. The curvature of his cervical and lumbar are both convex, and his thoracic is concave like it is supposed to be. I'm not seeing any abnormal curvature laterally or inside now. I'm going to first palpate, no, I'm going to percuss for a resonance. And it sounds nice and resonant throughout. And I'm going to check for tenderness along your spine. Tell me if you feel any tenderness as I go down. Anything on the sides?
Nope.
Feels all pretty good. While I'm here, I'm going to check for tenderness along your costovertebral angle here. Any pain there?
Nope.
Okay, very good. And I'm going to test for excursion. If you could take a deep breath in and out, and I see good lateral excursion of his chest. And can you say 99?
99, 99, 99, 99.
Good. And I'm feeling fremitus throughout his fields here. I'm going to test for excursion of your diaphragm. So first I'm going to start, if you could take a deep breath in, and I'm going to do it with your air in, go from resonance to dullness. And about here is where it gets dull. Okay, breathe out. We'll do the other side. Breathe in. Very good. And out. And that's about there. Okay. Now if you can take a brief breath in and blow it all the way out. I'm going to do this again. And that's about here. Okay, you can breathe. And breathe in. And all the way out. Push it out. And it gets dull about there. So I'm going to measure that. And that is about 4 centimeters, so that's a good excursion of his diaphragm. Okay, if you could, and then I'm going to listen to all your lung fields. So deep breath in through your mouth. Again. And again. 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 One more time. And I'm hearing good vesicular breath sounds throughout his lung fields without any adventitious sounds. Now if you could turn around. I'm going to do the same with the front, just about it. Again, he's got good skin, pink color. Take a deep breath in. He's got good excursion of his rib cage here when he breathes in. Can you say 99?
99, 99, 99.
Good fremitus when I palpate, and good resonance over his fields. Listen. Deep breath. Very good. So now I'm going to listen to your heart. You could just breathe normally. I'm going to first listen over the aortic area, assessing the aortic valve, the second intercostal, and pulmonic, second intercostal on the left. And the Erbs point, which is like the third intercostal. The tricuspid, fourth, and the mitral, which is fifth. And I'm hearing a normal S1 and S2 without any extra heart sounds. Now, if you could bring your legs up and lay on your back, I'm going to continue to listen for some murmurs. So, you're good. This time with the bell of my stethoscope and the aortic and the pulmonic. And the Erbs. Tricuspid and mitral. And if you could turn on your side. Good. Very good. You can come on your back. And I'm hearing no murmurs, no S1, S2, no extra heart sounds at all. And I'm also palpating for heaves. Or I'm looking for heaves and there's no heaves. I'm palpating for a thrill and there's no thrill here. The pulse of his PMI is right about the fifth intercostal space, midclavicular, the apex here. Next, I'm going to go to his abdomen. On visual inspection, I see his skin is again intact with no lesions, other than his normal little freckles. His umbilicus is midline. His hair is well distributed. I'm going to listen for bowel sounds. And I'm hearing bowel sounds in all four quadrants. I'm going to listen for bruits over the aorta. And the liver, the spleen, the kidneys, the iliac, and the femoral. And I hear no bruits. Next I'm going to start with a percussion, and it's nice and tympanic throughout. I'm going to check the border of the liver, so I'm going to start around the umbilicus with the good timpani sound, and I'm going to go till the dullness. And it goes right up to his rib cage. Then I'm going to come down. And it's about right here, so it is about 10 centimeters, which is, or 10, yeah, centimeters, which is good. So next I'm going to just do a light palpation. If you could tell me if you feel any pain when I palpate. Nothing? Okay, I'm going to go a little deeper. And relax. Let's put a pillow under your knees. Just relax your muscles a little bit. Okay, that's better. Okay, I forgot to palpate over your spleen. And it's double there. Now I'm going to have you take a deep breath in, and I'm going to feel under for your liver edge here. And that feels nice and smooth. Any pain? Okay. And on this side, deep breath in. Get two. Any pain? Okay. I can't really feel his spleen there, but that's okay. Now again, take a deep breath in. I'm going to see if I can feel your kidneys. And not really. Deep breath in. And your kidney. And I can't really feel it with his belly there. Next I'm going to feel for the pulsation of your aorta. And I can feel that just like left of midline. And I do believe that is it for your abdomen. While I'm here, I'm just going to feel for your femoral pulses. That's good and strong. Good and strong there. And I'm just going to feel for any your lymph nodes here. And I feel nothing. And here. That feels good. Any pain, tenderness there? Okay. So next I'm going to turn to his legs. And his legs to me look, I don't know if you can see them. His legs are symmetrical in his musculature and in length. His skin, again, is pink and skin is warm. I'm seeing no lesions, especially to his bony prominences. And I am looking for his range of motion, so of your toes. Good there, good there. Range of motion of your ankle. Good, good. And your knees. Good. And your hip. Very good. And ankle, toes, ankle, up and down, knee. Good. And your hip. Very good. And I'm going to feel for your pulses. Popliteal is a good 2+ there. And just relax it. And a 2+ there. Dorsalis pedis. Good 2+. And his posterior tibials on the inside of his ankle. 2+ there. And 2+ there on his left side, and dorsalis pedis on his left side is good. And again, the capillary refill on his toes is nice and brisk, less than 3 seconds. Feel like I'm forgetting something, but oh, let's test your strength of your feet. If you push against my hand, good, and my hand there. If you could raise your leg against my hand, good, and try and bring it down, good, and up, good, and down. And we'll do that again while you're sitting. Okay, if you could turn around and sit, I'm going to have you sit up on these pillows, get your feet off of the ground. There you go. So next I'm going to check the reflexes of his legs. Starting with the patellar. And the left or the right. Good. And his, you can't see it, but I'm checking his Achilles down here. Good. And on this side. That looks good. And I didn't get your reflexes on your arm, so I'm going to do that next. The brachial. Good. And on this side. Good. And if you could raise against resistance on your leg. Good. The other one, very good. Okay, next I'm going to have you stand. Yeah, and if you could start with alternating your feet, standing on one foot and then the other. Good. Now, if you could bend forward, touch your toes, that shows good range of motion of your torso. Now, if you could lean back, good there, and forward with your chest. Okay, so he's got good range of motion of his chest. Can you go side to side? Good. And the other side. Very good. If you could lean forward one more time, I'm sorry, I forgot to check the curvature of your back. And that looks nice and straight there. Now, if you could, standing on one leg with your heel, if you could bring it up to your shin and down, good. On the other side. And good. And he's got good coordination there. And with the palm of your hands, can you go back and forth on your... And good coordination there. Now, if you could stand with your arms out to your sides, close your eyes, hands up, and your eyes are closed, and see if you can just maintain your balance there without losing. Very good. Okay, and bring your arms down, and you can turn around. And that concludes our examination. Thank you very much.
Thank you.